maybe 90 up to 97% of MS patients have one or more venous problems. Point is, Canadian MS patients deserve science. They deserve evidence-based medical practices. But you can't have this if your government doesn't collect the evidence, either through clinical trials or a registry. Our Canadian patients have been traveling overseas since January 2010. I have a list of 10 doctors who have been treated. They were afraid to come out. They were afraid for their careers. I have one Canadian neurologist who said to me, if we had collected the evidence in the registry for the last many months, would we still be calling this anecdotal stories? In March 2011, the government has agreed to do a registry. We don't know the details of that or the timeline, though. Am I boring you?
No.
I don't want to bore you. I've asked hundreds of written questions of the government, attended 5 conferences now on CCSVI. The government has not gone to one. Why the refusal to listen to new science, to listen to new evidence? I take every opportunity to speak on CCSVI in the House, and I'm fortunate that our extraordinary MS patients send me petition after petition so I can do so. I was thrilled last February when Drs. Hakey, Hubbard, and McDonald came to Parliament Hill at their own cost to lobby for follow-up help, because our patients don't get help in Canada, clinical trials, and a registry. Going forward, what I'd like to see in Canada is that every patient not be refused follow-up care, because that's happening in Canada. There's no help when you come home. That we have an advisory panel with experts, people who've actually done diagnosis and treatment, and patients, so they can have their input. And what we really need is a nationally funded clinical trial in many centers across our country. I'd like to share, I got an unusual letter on March 16th, 2 months ago. It was from the Canadian Network of MS Clinics. And I'd like to quote from it. It is a theory based on the results of a small, uncontrolled study from a single site in Italy by Dr. Zamboni. And they go on to say that there's no other supporting evidence. I found this letter really surprising. There was no mention that we just come through the Polish conference and the Italian conference in the first 2 weeks of March. And the press release out of Italy was dated March 15th. Why was this information not included? In Canada, MS patients want answers. They want to know how emerging science and experts were willfully ignored, how special interest groups co-opted science, how an organization that was supposed to steadfastly advocate on behalf of MS patients flip-flopped on its position, how process was used not to do science, how conflicts of interest went undeclared, how a pioneering surgeon had to risk his reputation, how MS patients are forced to fight the system, and why they're being denied follow-up care. These are major questions that have to be answered. And I want to finish by thanking the doctors. Thank you for your compassion and your courage to be pioneers. I know how hard it is to do cutting-edge research, to come from another discipline and fight for a new way of doing things. When I did that expedition, I spent $85,000 of my own money in order to do it. And I know how bruising it can be emotionally, financially, and professionally when you do cutting-edge research. And I want to say to the doctors, thank you for standing strong in the face of adversity, for doing science and hoping that eventually evidence over ego, politics, and the various government lobbies will prevail. And finally, I want to say my last words are, as always, to the patients. Thank you for your courage, your tireless efforts to help bring clinical trials to Canada. You inspire me every day. Thank you.
We have a few minutes for question and answer. We'll also have a question and answer panel later. Does anybody have a question? Please go ahead and state your question.
All right, then. Thank you very much for coming from Canada. I have one question. Who is the government official in charge of setting up the registries in Canada? What is your name?
We don't have any of the details right now about the registry.
Well, who's in charge of the process?
Well, we believe it's the Canadian Institutes for Health Research, but we don't have that information.
There's no minister in charge.
We do have a minister, but it's only. Oh,
That's my answer.
okay. All we know so far is there will be a registry. We have no details. We have no timeline for it. It was announced right before the government fell.